Today's topic is ligament treatment, how to properly heal while limiting setbacks. Right at Choffner Rehab and Recovery here, we helped kind of bring you guys rehab directly, and we take you from pain to 100% progress. So if you're looking for help with your PT experience and your rehab and recovery, and just haven't had a good experience, feel free to comment down below if you're watching this on Facebook and or YouTube. But this month we really focus, guys, on ligaments and how to properly diagnose them, how to treat them. We looked at the different three kind of levels of sprains or grades, you can call them. And today we're talking about really how to treat them. And if you don't really know how, or you're stuck, or you're struggling in your kind of rehab and recovery process, then you should listen up, okay? Stop searching Google or YouTube, trying exercises and restarting the whole pain cycle, which can happen pretty frequently. All right, take some notes here. We're going to talk about 3 phases tonight in detail, and we're going to use ankle sprain as an example, a grade 1 or a grade 2 sprain. A grade 3 is a complete tear, like we talked about in a previous video, so go back and watch that if you haven't seen it. That'll be a different kind of case of treatment. And I do want to mention, guys, again, no kickback for this, but 2 books I strongly recommend you read if you want to rehab properly on your own. And they are big books, they're long reads, but they do help a lot. Number 1 is Rebuilding Milo. This is by Dr. Aaron Horschig. You can follow him on Instagram at Squat University. Then the second book is Rehab Science. Okay, this is an awesome book by Dr. Tom Walters. You can follow him on Instagram as well. He said Rehab Science, at Rehab Science. Okay, so those are 2 awesome books where we pulled a lot of these phases from. And I've used a lot of this stuff with clients, mainly weightlifters and athletes. And I can tell you it works very, very well. And I've used it on myself to recover from injuries as well. All right, so let's dive into the topic. Phase 1 for tonight and how to properly heal your ligaments, right? If we're talking about an ankle sprain, we want to alleviate your ankle pain. Number 1, we want to reduce inflammation. Number 2, we want to improve your mobility. Number 3, or the range of motion around that ankle joint. So you want to do a certain group of exercises every single day, right? If you're super sore, you can always take a day off of rest in between. But because it's mostly mobility and little movements, it's okay to do it every day, meaning 7 days a week without any rest. Okay, you're not going to have anything bad happen from that. You can use a foam roller or resistance bands for some of the exercises in terms of equipment, right? And you only want to move to phase 2 when you have 0 pain at rest out of 10 and or mild pain 3 out of 10 with exercises. Okay, so if you're at a 4 or 5 out of 10 with pain, you do not want to progress to phase 2. You want to stay in phase 1 for a little bit longer, sometimes 1 or 2 weeks. Or if you have pain at rest, you still want to stay at phase 1 before you progress. So a good example of exercises for this one, if you're dealing with an ankle sprain, would be kind of just foam rolling your calf and plantar fascia, right? You can use a lacrosse ball if you're doing your plantar fascia on the bottom of the foot. You can use a foam roller if you're actually kind of working into your calf, or you can do 1 leg at a time if you're dealing with 2 ankle sprains. That is number 1. Usually do it for about 60 seconds, and you want to pause on tender spots and hold them for 10 to 20 seconds, 5 to 10 times. Okay, those are the main 2 things you want to do in phase 1, right? Get some blood flow to the muscles around that ankle joint and reduce some of that soft tissue tightness there. Phase 2, we want to reduce foot and ankle pain, right? And we do that through early in ankle and foot strengthening, right? That was a bit of a mouthful. So number 1, reducing that pain, right? We do that through a certain series of exercises, and we do it about 3 to 4 days a week. Okay, now because we're getting into early foot and ankle strengthening, we want to take a little bit of rest in between doing these exercises. So usually 3 to 4 times a week works where you do a Monday, Wednesday, Friday, or a Saturday or Sunday split. Okay, you want to give your body time to ample time to recover and repair itself and kind of regenerate, eat a lot of protein to help it recover at the same time. So this will require resistance bands, right? Resistance loops, right? The small bands you'd put around your ankles or your feet, and even a plyometric box or a bench. Okay, and then we only want to move to the next phase, which is our final phase, phase 3, when you can do the exercises with no more than a 3 out of 10 pain. So if you can do the exercise with less than a 3 out of 10 pain, boom, that means you've hit the criteria to progress to phase 3. And an example of exercises in this second phase would be like a double leg calf raise with your legs straight and a double leg calf raise with your knees bent. Okay, that's a very general, just dynamic strengthening exercise. It's super easy, right? Don't worry, you're going to load it in phase 3. So that's just body weight for phase 2. All right, so say you get through that, you're less than a 3 out of 10 with pain. We're getting into phase 3. This is the final phase of your rehab and recovery here. This is where we're going to increase your ankle strength, so building up the muscle tissue around the joint, improve your stability and balance through doing a lot of single leg activity, changing up the kind of surfaces you're standing on or the weights you're holding in each hand. And you want to prevent ankle pain and injury from further worsening. Okay, those are the kind of 3 main things we're focusing on in phase 3. So you can do this just like phase 2, about 3 or 4 days a week. So you still want to take a day of rest in between your workouts. And you want to do 3 sets of 10 to 15 reps. 10 to 15 is a good criteria to stay in because it works at endurance and stamina, right? It's going to be a kind of medium level weight. It's not going to be too easy. It's not going to be too hard. It's going to work those type 1 and maybe a little bit of type 2 fast twitch muscle fibers together, which is great. And you want to actually push your sets to fatigue. I don't know if you guys have ever heard of RIR. It just stands for reps in reserve. Reps in reserve means how many reps you have left in the tank before you fail. So typically you want 2 reps in reserve on this phase, right? Meaning that if you're doing 3 sets of 10, right, that's the kind of minimum here, you should be able to fail at kind of rep 8 or so, right? You want to get to 10, but you should feel like you can't really do 2 more. You can't really get to 12. It'd be too hard. And if it's too easy, right, switch it up, make it harder by switching to a single leg, or add more weight to it, right? That's another way to make it challenging or slow down that tempo. All right. You want to use dumbbells for this one. That's really the only equipment you need. And when you feel really good and your pain goes from a 3 out of 10 to 0 out of 10, you want to transition to a full body routine. When you transition to a full body routine, you should have no pain at rest, and you should start to feel a lot better because you're getting blood flow to every muscle in the body, meaning you're going to prevent further injuries in other areas of the body because you're not going to be overcompensating, right? You need to build up those other muscles as well. They're just as important as the area you just injured. Okay. And an example of an exercise in phase 3 would be a single leg calf raise with weight. So you can hold kind of a dumbbell in one hand. You can do single leg calf raise, like holding onto something for support with your legs straight and with your knee bent. Okay. And the reason for doing with the leg straight and knee bent, because you're going to work 2 different calf muscles when you do that. When the leg's straight, you're going to work your gastrocnemius, being the big belly of the calf. When your leg's bent, you're going to work your soleus muscle. That's especially important for a lot of runners. If you're a runner, soleus calf raises with your knee partially bent in a mini squat are very, very important because they're going to help protect your shins and your ankle joints and your knees from kind of damage and wear and tear. All right. So that are the 3 phases for tonight, guys. Right. Again, phase 1 alleviates ankle pain, reduces inflammation, improves mobility. Phase 2 reduces foot and ankle pain and does early foot and ankle strengthening. And then phase 3 increases your ankle strength, improves your stability and balance, and prevents further ankle injury. All right. So get into those phases. Try some of those exercises as an example. If you're dealing with an ankle sprain, if you're dealing with a knee sprain or low back sprain, fits the same criteria, just different exercises, obviously. Right. So now you guys should have a good idea of how to heal ligament injury, being a grade 1 or a grade 2. And, we use ankle sprain as an example. But if you guys want to see a different example, let me know and I'd be happy to make a video for you or chat with you. Thank you so much for watching. Be sure to like and subscribe to our YouTube channel at Choffner Rehab and Recovery, where we reassess and pick up where traditional PT left off with you guys. And we really work with only weightlifters, helping them rehab to 100%. All you need is a phone signal and a backpack of equipment. That's it. Super easy. All right. Thanks, guys. And we'll see you next week where we're diving into tendon rehab and recovery.